اسمي اسلام الحارثي، دكتور نفسيه.
نعم.
كنت تعرفني باسمك؟
اسمي ناصر.
نعم. كم عمرك اصلا؟
عمري 26 بس دكتور معليش المقاطعة.
لا سيف لازم يعني لازم ترفع صوتك شوي.
معليش المقاطعة دكتور. اللي بيننا بيكون سري يعني بحت 100%.
لا ان شاء الله ما راح يطلع شيء.
تمام. انا صراحة سجلت معلومات عندهم غلط اني انا لاعب يعني معروف.
يعني وش وظيفتك؟
ما لاعب انا في نادي معروف.
طيب متزوج؟
لا.
كم عمرك؟
25.
25؟
26.
خير ان شاء الله.
انا جتني اصابة في الملعب ورحت المستشفى وصار عندي رباط صليبي ومتعود يعني على الإصابات، لكن هذه الإصابة كانت غير يعني كانت مؤلمة مرة. أخذت مورفين وكنت أخذ يعني بزيادة على أساس الألم ما كنت أتحمله، لكن يعني جتني كذا مخاوف وسمعت إشاعة أن يعني الناس عرفت إني آخذ مورفين وأنا ما أحب يعني الناس تدري، صرت آخذ بشكل أكبر يعني بشكل أكبر عن الحاجة يعني أثر على حياتي.
من ناحية ايش أثر عليك؟
ما عاد عندي طاقة يعني أصدقائي كذا نومي سيء، خوفي الأكبر إني ما أرجع له مرة ثانية.
أنت الحين في إجازة ولا هنا؟
ما في أي شيء أسويه.
يعني أنت ماخذ إجازة من الدوام ولا كيف؟
عشان بحكم إصابتي أعطوني إجازة، لكن
سامعين كلكم؟
دكتور معلش أنا سلو تون مرة فعادي أرفع يعني.
No problem. We can hear you. هي المشكلة مع سيف.
بس اسمع صوتك سيف.
بدل المايكات.
بدل المايك. كويس. Thank you very much for this suggestion.
يعني ما في شيء أسويه. طولت أنا شوي، المفروض إن الإصابة ما تقعد معي الفترة هذه كلها، بس لأني ما أروح لا علاج طبيعي ولا شيء أساساً يعني شكلي ما ينفع أطلع للناس يعني جاي أنا الحين صار ما بدك تشوفني.
طيب يعني ليه ما رحت علاجات طبية ولا ما سويت علاجات؟ اتبعت علاجات أول؟
ما في طاقة أبداً صراحة إني أروح، وبنفس الوقت يعني ما أقدر كذا أقوم بسبيل صراحة، يعني أبغى جدا فيه.
يعني أنت فقدت الطاقة قبل لا تزود في الجرعة حقت المورفين ولا بعدها؟
الطاقة من قبل بحكم إني ما أقدر أتحرك كثير، كنت تعبان وقتها، بس يعني الفترة الأخيرة صار الموضوع يعني مو في جسدي أكثر، صار من صرت نفسيا مالي خير، بس قبل كنت لا نفسيا ما عندي مشكلة، صح إني تعبان جسديا بس الحين صار نفس الموضوع أكثر شوي.
متى صار هذا؟
الإصابة كانت قبل 5 شهور.
هل يعني بس هذه أثرت على وظيفتك؟ هل أثرت على يعني علاقتك مع أهلك أو كذا؟
أتهرب أنا كنت يعني أنا حولي ناس كثير يعني والاجتماعي بحكم أصلاً شغلي يعني ولعبي بالكورة، أنا ناس كثير دائما يعني مع الشباب، دائما تمارين، دائما حتى مع الأهل، يعني أنا كنت أصلاً أنا أقوم بالعائلة كلها، لكن الفترة الأخيرة يعني كنت يعني إني أطلع معكم صراحة.
أنت متزوج ولا لا؟
لا أنا آسف ما تزوجت.
طيب في هوايات كنت تسويها قبل؟
إيه كثير صراحة يعني كنت نشط مرة يعني، ورياضي غير الكورة، والكورة أحب يعني داخل أنا أحبها من صغري.
يعني الحين ما عاد تسوي أي هوايات، تركت الهوايات؟
والله هوايتي الحين السرير مع الكورة.
وش كنت تسوي في فراغك أو وقت فراغك؟
الفترة الحالية
الفترة اللي قبل الفترة.
قبل كنت يعني وقتي مليان يعني مليان، ويعني ما بين مباريات وإنه فريق يعني فريقي أنا صراحة يعني قوي ولعبنا كثير يعني.
طيب الحين يعني ما عاد تطلع مع أحد في البيت بس يعني؟
إيه بس.
طيب تقدر توصف لي علاقتك مع أهلك؟ هل يعني علاقتك
حالياً
كويسة ولا؟
ما أشوفهم صراحة حاليا يعني قليل ما أشوفهم إذا كنت يعني شفت نفسي بأفضل حالاتي نزلت أشوفهم، بس يعني قليل مرة.
يعني أنت عايش في حالك؟
إيه جالس وقت جديد حالي.
طيب معلش مثلا يعني علاقتك مع أهلك لما كنت صغير يعني كيف كانت؟
ممتاز ممتاز جدا.
هل كان في أي يعني كان الوالد ينطق أو كذا فيكم؟
لا ممتازة يعني الوالد كان محترمني وأهلي محترميني مرة يعني، أتمنى يعني هم كانوا يبوني يصير دكتور بس إني أنا كنت أبي ألعب كورة يعني هم كانوا محترمين هذه مرة.
طيب الجرعة يعني زودتها مرة ولا زيادة بسيطة على عشان مو في؟
كل شوي آخر عشان أنام يعني، كل شوي آخر. أول كان عشان الألم بس إني كنت أزود يعني، لأن الإصابة هذه ألمها صراحة غير بالنسبة لي يعني، لكن صرت أزود زيادة يعني ما.
يعني السبب الوحيد انك زدت في الجرعة علشان تخفف الم؟
بالبداية، ولكن تدهور بعد ما يعني حسيت إن الإصابة بتطول وبديت أسمن، حسيت إني ما راح أقدر ألعب مرة ثانية ولا يصير لعبي نفس أول يعني.
هل زرت اي دكتور ثاني قبل لا تجيني؟
لا أنا صراحة أول مرة أجيك، يلا قدرت أجيك يعني.
في حد قال لك تيجي ولا بنفسك؟
صراحة ما حد يدري، بس هم الوحيدة اللي درت من فترة دخلت تنظف غرفتي وبيتي يعني، شافت بس شافتها كثير يعني، شافت عندي أكثر من علبة، فقد استغربت يعني معقول تستخدمها كلها وهي كلها نفس الشكل يعني، فشل. فصرحت عن الموضوع وصرت إني أجي هنا، وأنا صراحة ناوي الوالدة علاقتنا قريبة لاحظت كذا ليش.
طيب الحين جاي هنا تبي نساعدك يعني في وش اللي تتوقع مني اني اساعدك؟
أنا صراحة أبي أرجع يعني، أبي ترجع حياتي زي ما كانت قبل يعني، وأبي أحس إني أنا صرت ما أقدر أترك الدوام يعني، لازم يكون جنبي حتى لو ما في شيء يعني، ما في ألم، أحس إنه لازم يكون معي، ما أدري ليه يعني، أنا وياه. والفترة الأخيرة صار صديقي يعني.
طيب كيف كانت انت علاقتك يعني بالعمل قبل لا يجيك الإصابة؟
ممتاز، أنا كنت يعني معروف مرة، ما أقدر
يعني كانت وظيفتك
ممتاز مرة ما كنت.
طيب هل تشتكي من اي امراض ثانية؟
لا الحمد لله ما عندي شيء.
هل سويت عمليات قبل؟
لا
عندك حساسية؟
بس عندي إصابات قبل أنا، بس إنها بسيطة يعني.
عندك اي حساسية؟
لا.
كيف العائلة؟ هل العائلة عندهم أي مرض مزمن؟ الوالد الأخوان؟
لا الوالد بس يعني الأشياء اللي كل الناس عندهم سكر كذا.
طيب أنت تتوقع يعني المرض وش سببه يعني؟
والله أتوقع يعني صح ما أدري يعني شو أقول الدكتور، بس أحسني يعني يمكن كذا كنت أكثر.
You get 2 minutes more.
يعني تحسن يعني من زيادة المورفين؟
أتوقع إيه، بس ما أدري يعني، مع إنه ما أحس إني أخذت كثير ممتاز يعني شيء، بس ممكن إنه هو السبب يعني، بما إنه هو الشيء الأخير اللي دخل حياتي.
طيب في الحالة اللي أنت فيها هل فكرت إن بعض الناس يعني في الحالة اللي هم فيها في التعب ولا المرض فكروا طبعا ما يعيش الحياة اللي هو فيها؟ فكرت في الانتحار لا قدر الله؟
مدة حياتي ما فكرت بالشيء يعني، بس أنا ما جيت إلا عشان أبي أقدم أكثر إني أرجع طبيعي زي قبل وأرجع حياتي زي قبل، لكن يعني ما فكرت، بس يعني تمنيت إنه ما جتني سلطة صراحة.
طيب بالنسبة يعني معليش أنا بسألك هل يعني أنت تاخذ تدخن ولا لا؟
كنت أدخن يعني، بس بطلت بس ما مرة.
من قبل كم سنة؟
يعني كان عمري 16 كذا، ودخلت فترة بسيطة على طول قطعت يعني
وهل
عشان المباريات وكذا.
هل تاخذك يعني تشرب الكحول شيء ولا؟
لا ما أشرب.
هل عندك يعني هل تاخذ أي علاجات ثانية غير المورفين؟
لا ما عندي شيء.
أنا معليش بسألك يعني كيف علاقتك مع الله؟ يعني هل الصلاة يعني تصلي كيف محافظ على الصلوات؟
أول بس الحين ما كنت أعرف.
يعني أول كيف ما شاء الله إنك محافظ عليه.
الحمد لله.
الصوت ياسين، الصوت.
يعني الحين يعني الصلوات يعني ما أدب زي أول.
والله نص يعني يا الله نص وقتي جاء يعني كذا، ما صحت أنا ما سمعت بروحي يعني، بس يعني إذا ذكرت ما ذكرت صراحة.
طيب أنا بدي أشكرك إنك يعني جيت هنا عشان تعالج نفسك، لأن بعض الناس يعني ما يصعب عليهم إنه يجي للمستشفى الدكتور النفسي، فأنا أشكرك على شجاعتك. أما بالنسبة للمرضى يعني إحنا نشوف إن بالأعراض اللي ذكرتها إن زيادة جرعة المورفين هي اللي أثرت عليك واللي جابت لك التعب النفسية. فنعطيك نصرف لك علاج بنزودازابين، ونسوي يعني نحاول نعطيك يعني يمكن جلسات عشان نحاول يعني أشجعك على إنك تترك المورفين وقلل يعني الكمية.
الدكتور في إمكانية تكون أونلاين وكذا، أنا يلا جيت أصلا ما تعرف أساس ما حد يعرفني وكذا.
يعني نحاول يعني نطبق لك وضع حتى لو يكون يعني ما حد يعرفك، أو نسوي لك يعني تكون بيني وبينك.
طيب طبعا.
Thank you very much. I will not spend too much time. I want you, please, just to give feedback to your colleagues, say, positive and negative. I can understand that the voice is not that clear. حد واجه مشكلة زي دي في السماع؟ ولا بس أنا because I have a gray hair. طبعا أنت ما عندك gray hair. واجهت مشكلة في السماع ولا لا؟
لا.
Do you have, okay, thank you. Do you have any comments on his interview? Now you are expert. You should say something. Do you think that he has facilitative techniques? First of all, does he have open-ended question, and how frequent? Hamad, تفضل.
Regarding to the question, yeah, he had both of them, but what was very interesting that he was respecting the privacy of his patient. He like give him the confidence, yeah, it's okay, you can talk and say whatever you are. His tone when he talking to him, it's like he was preparing everything set up to give him a confidence to talk, because he was like, don't want to talk.
Okay, yes, I agree. Any other things? Any negative things? Look,
Yes.
please.
The patient was hesitant regarding alcohol admission, and the doctor didn't take the point behind.
The issue is you are so nice person. Don't be so nice, over nicing, it is like over aggression, sometimes that's good to be nice, but you need to be assertive, they call it. We have 3 stages, either to be aggressive towards others, or submissive, مسجوخ, or to be assertive, unlike you, who are a human being, I am a human being. We have, something we have to just sit and talk. The most healthy way is to be assertive. I will not allow you to humiliate me. I will not, whatever, okay? Or at least just, it is my right to ask you anything just in a professional way. So you need just, sometimes your tone can give an impression to your patient, so that yes, I'm in charge here and assertive, I'm professional. I'm not even, if you are, and this is a side issue, if you are in front of external examiner, and to be involved, you didn't go through external examiners.
We did.
And the postgraduates, you might have, this experience. That means somebody who doesn't know at all, came from United States or whoever. And then he will just see, are you really, do you deserve this certificate as whatever? I was external examiner in many countries for the postgraduates and even the undergraduates. So if I ask you something and you started to lower your voice, that will give me an idea that you don't know the answer, that you are not aware of that. So even if you don't know something, don't lower your voice. The tone of your voice reflects how confident you are. Okay? No need to shout, but at least to be not in low tone. Normal tone will be okay. This is my, sincere advice to you. You need just try to shout. Okay? Okay, tell me about your patient.
My patient is Nasser, 26 years old. He's
Raise your voice, okay?
My patient is Nasser, 26 years old.
Okay.
He's single. He came to the clinic complaining of.
See, you are knowledgeable. I love this. Okay.
He came to the clinic complaining of fatigue, and he had a profuse injury in his knee, and he been prescribed morphine for the pain, and with the pain he started increasing the dose of the morphine, and after that this symptoms started getting more
Worse.
worse.
That's excellent. Thank you very much. Yes. Till now, what are the diagnoses?
Diagnosed morphine mental disorder because of the use of
It is substance
substance disorder,
abuse
abuse of
or substance use disorder. You need, please, you need just memorize the name of what you are talking about. Show me that you know. Doesn't matter, maybe psychologist, journalists, they can name the disorders. How come you are a doctor, okay? Doesn't mean that you don't know, I'm really every now and then reinforcing. Please, سموا الأشياء بمسمياتها, just name things as they should be. Okay, so you think till now that he has substance abuse disorder, which is opioid.
Yeah.
Okay, that's great. Would you think this is كمل بعدين الاثنين I don't want to bias you. كمل. في something else you should ask about? Because many issues. Please pay attention to this session. Many things you need to learn from what's going on. So like Hamad Maskin had called you, okay, go and أيوة الله يعينك. دعي له بس okay.
He was afraid of losing his job, like he said, I may not play again,
That's good, okay.
and maybe this is also a reason for his increasing the dose.
Okay.
He came, and it's feel for me like he really wanted to get treated,
much.
Because when he came
This
straight
is
away.
very important issue. What we call this is the patient. If you term here, this is the first thing you need to learn whenever you approach any drug or substance abuse issue. You mentioned that, but maybe
Contacted.
maybe the ish
Contacted.
motivated. So now the patient, he came by himself and he wants to get rid of this. That means he knows that he has problem. And the first step to solve any problem is to see, do you have the problem or not?
Sure.
I'm depressed, but I'm not realized that I'm depressed. This irritability, this low mood, this low concentration, this failure, this whatever. I don't know that I'm depressed. So the first line to solve any problem is to see, to see what I have, to see the problem. So when you say that this drug addict patient is motivated, that yes, that's good, that he knows, he has insight about what's going on. That's good.
He was more motivated.
So this is the first major principle in approaching any drug addict patient.
He has some idea why he's having this disease, and the reason for his coming because his mother discovered he using more morphines, so she encouraged him to come.
That's good.
Um,
This makes sense. Okay.
think about this one.
Okay. I'm listening. I don't want to bias you, but I'm so sorry. I will put much weight on your, approach because I want everybody to learn. Okay, what else? What you want to tell me? خلاص الhistory present elements.
I think it's just having a problem.
Okay. Go to them. What? Continue.
We start with the mental examination.
No.
What's that? He has doesn't have any disease, no allergic. His
No physical
No,
problem.
no
You can
physical
try
problem.
to summarize your finding. Try to put, the things together. This is the way you look more confident, more knowledgeable. Okay.
his family history.
So no major organic problem
He just
other
had-
than his knee problem.
Yeah, he had just some minor injury before.
Okay.
No surgery, no previous surgery.
That's good.
And
Thank you very much for mentioning that.
his family history, it's like they don't have any disease from his family.
Okay.
He was a refuse smoker a long time ago.
Okay.
Uh,
He stopped smoking.
Yeah, he still smoking since he was like 16 years old.
Okay.
That's
That's good. Asking about smoking.
Uh,
So, in general, let us just make a rule. Whenever you ask about if you have a drug addict, see if he is motivated when he came, to you. He came alone, or somebody brought him, or the police brought him. The other things is ask about any other drug abuse, any other substance abuse. Part of it, smoking, and what else?
I asked him about any other drug than morphine. He said no.
Thank you very much,
We
yes.
asked
So
him
he
what-
is screening, so just as if you are just clicking on the menu and you have a list.
And I asked him about alcohol.
Alcohol,
But
that's
he
good.
he didn't give me a direct answer. He stopped for a while.
Thank you very much. That's really vital things. And thank you for using your common sense. I believe medical students are really clever, smart people. Use this smartness. Okay, otherwise you will lose your mind. You have good abilities. Utilize it. So he utilized this. He said that he doesn't want to talk about something, but you need to be smart enough. Why? Okay, and the most important thing is to discover if there any problem now or not. ما حابب إني to suggest like and go ahead. At least we will ask about any other things. Okay.
He had no allergic.
Forget about please. حتى حمد طاح في نفس الموضوع. Most of you will just think mainly about the organic issue. You have been studying this organic issue for the last 5 years, okay? Now, please, we need to concentrate on the other aspect, social, psychological. You said it now twice, that he has no allergy. Yes, we agree that no allergy. We summarize it as no major physical problem. And I like to call it organic problem. So organic, besides psychological. طيب.
We asked him about suicide. He said.
Thank you very much.
He said,
Before going to the other things, finish the psychological issue. Suicide is part of the psychological history.
it's the
Okay.
most important thing. So we asked him about suicide. He said he didn't ever think about it.
Okay. Honestly, I didn't hear you, and I don't know your approach, how it was.
I asked him. I said to him, sorry, I'm going to ask about something. Some people.
Thank you very
in
much.
this situation may think about they don't want to live in this life.
Okay.
So did you think about anything?
Thank you very much. That's excellent. Okay.
He said no. He said his life before is good. He
Not
just
in a
wanted to,
suicide.
he wanted to return to his.
Excellent. Excellent. Thank you very much. Yes. Okay.
I didn't ask about hallucination, delusion and hallucination.
You need to. This
Yeah,
is
I forgot about it.
always think about, one psychiatry. Let us just think about Khaldun's 5 steps, okay? 5 things, 5 lessons. Okay, suicide, psychosis, what else?
Sexual.
Now you are at the stage, you finish the chief complaints, history of present illness. We will discuss that more a little bit. And then screening, system screening, which is 5 S's. This is suicide, psychosis, sex. Okay.
I asked about spiritual. Ask him about social.
That's good. Spiritual things. Okay. Okay. خلاص هتروح للمنتال ستيت ولا no before؟ طبعا the history is not enough at all. He missed, I don't know, just it is just you are here to learn, you and others. Anybody of your colleagues, they might have the same problem. So it is not you personally, okay? Whenever you ask about substance, now we are dealing with substance, right? Substance, just to click on the menu. You should go for at least, I just include that in the morning. Smoking. تذكر إيش how much he is smoking? Packet, ton of packets or whatever. You need, no. Forget about it. I'm talking about the principle.
How many?
The principle you need to know, well, I'm taking water. How much water you're taking? It is just big or just, you need to know how much I'm
I
taking
wanted
water.
to ask him, doctor, about this. So I didn't know how to ask, so I asked him, did you take more than how many more? So I made a mistake.
بس أنا قلت لا.
I'm not criticizing. I'm just,
I'm asking doctor how I can ask him how much in morphine exactly.
of course, how frequent he's taking. How much, how much he's taking something. لو كان ياكل خشب يقول لك تاخذ خشبه ولا خشبتين ولا whatever the case.
دكتور هو سأل.
Don't unless you will add something more.
لا
I don't want to defend, it is not a defensive, I'm not attacking anyone, okay? Just I would like you to know,
أنا سبقتها وأنا أقول أسبقتها.
and he should know. أنت الآن خلاص رحت بيتك. We don't know you anymore. Now he is here and he is in with his supervisor or whatever, and just we want to know what was going on. So please try, so you need to know the amount, صح? Okay, and you need to give me how much. If you use it once or twice, or before sleep, after sleep, talking what are the circumstances he should take it just before the pain. The other things, if he took it, he will have what? He will released by the pain, or he should go to the hospital. Many issues. regarding any substance. He's taking anything. لو عصير. صح? Okay, this is the first thing. Please, when you are clicking the menu of drugs, any substance, you need to mention the amount, the frequency, day and night, and the social setting. Is he taking in the social setting or he is alone? Just he look himself in his own room and he just started drinking, for example. Okay? So you need to tell me how he is taking this. Just by common sense in the history. I know it is, but that I'm raising this in your awareness in you. Later on, if you face this issue, please try to think about it. The most important thing is not that. Is, do you have any two things? And this is the major things when you are asking about substance. Let me say something, and then you will be in trouble. You don't know what's going on. وزي ما نسيت إن شاء الله ما أنسى. I will ask you this question later on. لكن الآن we should ask about the substance itself, how much, the social setting, and the other two things I will ask you at the end after you will give me official answers.
And from where?
From
where he take the drugs?
That's good. This is why you are asking this. That's good issue. But why? You know why?
Because maybe he was go to the drug dealer, different from doctors.
Thank you very much. What you deserve. Well, bonus, hearty bonus. What is the mental state? And then we'll go to the diagnosis and then.
Mental state, the appearance, he was covering himself. He was injured in the knee. He walking on.
Thank you very much. Yes, now the picture is okay. I can see the picture. I'm at home. I didn't see him. Okay. So he is just, okay, tell me more. Draw me his picture. So the appearance, can be the appearance. Remember what you have said. Is he reasonably dressed?
Yeah, it's
This is the first thing. That give me the normal thing. Okay.
That's one of the things.
So sorry, just give me another 15 minutes. بس يعني نمشي معي بنفس السرعة. Okay.
طيب خلصنا الابيرنس كده؟
طيب خلصنا بنفس. Okay, before that, is he smelly?
No.
This is very important, right? We are dealing with the drug addiction. You need to mention that he is yes smelly or not smelly. Okay? Is he shivery?
No, he wasn't sure.
Okay. Sometimes you need to give more even negative things. It is not because you are ruling out something. Okay, yes, he doesn't have this, he doesn't have that. I will end up with the diagnosis or professional diagnosis. Okay?
Graphic, mood is.
Before that, do you think that you missed something in the appearance? Vital things in drug addiction. I taught you that in the first or second lecture.
The computer was scarce.
Thank you very much. Did you?
He covered himself.
With examination, you ask him uncover your hand.
See, look, I'll tell you something. You are in the golden time to learn. When you are like me, you will feel shame to ask something that you should know. You are not supposed to know. Of course, the answer is yes, of course, please. لا افتكر لي اياها يا حبيبي, and I want to see what's going on. Okay, this is my responsibility. Yes, you have to. The idea is don't be defensive, just take it positively. Yes, you're right. This is objective things. Do you think so? You can just let him just please just uncover your own. Okay. Thank you very much. This is very important, and you should say it. This is a 5-star approach. Everybody can do it. No need to be expert or consultant. minor things. You can do it that, well, raise your level of practice, okay? طيب, this is the appearance.
The note he looks sad, sometimes some distress, because he was looking down.
Yes, Dan, thank you very much. Yes, I agree. Okay, move to
Behavior, he was cooperative.
Thank you very much.
Really trying
Yes,
to
he was
get-
cooperative.
He was really trying to get the treatment.
Okay, thank you very much. He's motivated. He was motivated and cooperative.
Perception, he was not, I don't think he's an illusion, or I didn't ask, but he did.
Please don't forget, write it down. He denied. Better than he doesn't. Okay?
حتى لو ما سألت الدكتور.
لا كيف ما تسأل؟ You will ask him and he will deny. You cannot say denied without asking him. Do you hear voices that other people they don't hear? Yes or no? If he said no, doesn't mean that he doesn't have, he might have hallucination. But هو أنت ما عبيت عينه, doesn't want to tell you that whole story. Okay, so he denied, that means you are more objective. You are scientists. It happens to many times. Some, you will be embarrassed. You will find it later on when you go and practice and do your internship. You'll say something and you'll tell your supervisor, well, he doesn't have this. And the consultant asks him, do you have this? Yes, I have it.
Yeah.
You will be in bad situation. If you say he denied, yes, okay, you are objective. You are really scientist person, okay? But come in. So he denied, agree. That's good. We learned something. Okay.
We finished the perception, we go to cognitive.
Okay. طبعا بالperception we have two things.
The illusion and
Eye illusion, thank you very much for you just make it مطيت الآية صارت eye illusion because the most common illusions. What is the definition of illusion?
he sees the thing.
I will remind you again. Go global. It is abnormal things or normal things?
Abnormal.
Abnormal. Well, خشب ولا
Normal.
Thank you very much. Abnormal perception. So this is a perception, and this is abnormal perception. Characterized by, بس احفظوا هذه الكلمة. Go from the general and then just specify. You will not be in trouble if you are anywhere. You will feel okay. Characterized by.
See and think.
Which are not exist. That's good. So it is abnormal perception characterized by seeing things or perceiving things doesn't exist, but with real stimuli. Sorry. Okay. So it is abnormal perception with real stimuli, while hallucination is abnormal perception. What else? Okay. خلصنا B and B.
Cognition.
Okay.
Cognition, it's orientation.
Okay, it's not quite orientation, no problem.
He seemed oriented. He came to me knowing where he going. Yeah. And
صدقتك والله العظيم. But you can say for time, place, TPB, time, place, and person. Okay? Time is oriented for time, place, and person. Something. Okay. What else in the C?
In the C, the form of idea. There's no
Form of thought
form of
issue.
Yeah, there is no.
There was no form of thought disorder. Thank you very much. Yes, I agree. What about other things? Content.
It's constant. There is no.
Content, that means what is inside the train. Does he have obsession? Does he have delusion? صح.
No obsession.
Okay. Did you ask about delusion? Okay. You need to make sure you know that. Well, I missed that. So to ask about this is important things, but I missed it. Everybody can miss it. Okay. try to ignore yourself, right? Not to be defensive. So that means, yes, you are objective. Yes, I did something, I had to do it. Okay? You look more, put yourself in this image. That means you are not defensive. You don't want to defend yourself and say that I'm okay, but you missed it. So dear, you missed it anyhow. Describe yourself, whatever, but you missed these things. So this is what, in order not to be in this bad situation, just say it, okay, I really messed up. So be honest. Okay. طبعا in this, in this situation with drug addiction, it is very rich white personality disorders. Very rich area. You need to explore. He is كمل بعدين خلصت المنتال ستيت بعدين
communication. His tone was low.
He was talking in low tone.
Low tone.
هو اثنينكم كنتوا تحكوا بلو tone. Okay.
Fall of the
Normal flow
normal
or
flow.
slow.
Normal flow.
Okay. So just you will comment on high tone. Oh,
Sorry.
yes, this I meant it. I want to wake you up, all of you. High tone. Okay. Rapid flow or slow, low. Okay. That's all about the tone. Okay.
It was slow flow, and his tone was low, and
Okay. So almost okay with the normal. Okay. So what investigation?
blood test to investigate the level of the movement blood.
Usually, how you discover drugs in the body.
By urine.
Please give him a chance.
Urine analysis.
Thank you very much. We rarely use blood tests. We use urine analysis.
So we didn't wait for you, so just one.
Well, خلاص واحد كفيس. Okay, urine analysis. Okay, good appearance. What else?
I think drug abuse is just by your
He is low. Would you do some other investigation? Could this low mood because of something else?
the thyroid.
You need not to forget this time. Okay. Okay, what is your diagnosis?
Diagnosis is substance abuse. Use morphine.
So, substance abuse, opioid
Opioid disorder.
disorder, okay.
Differential diagnosis.
لا لا كمل أنا I'm listening because this is the serious issue that I'm going to discuss with you. The diagnosis is not completed yet.
The substance.
Please be attentive. You will have definitely cases of drug in the exam. Please listen carefully. Okay?
The substance is morphine.
Okay. خلاص فهمنا. لكن في another. This is the thing that I postponed asking you during the history taking till now because you will be in trouble now. كمل. It is not only you, anyone. They might have the same issue. But you are now, in the hot seat. مسكين. أنا دقيقة من أعماقي.
Doctor, another diagnosis? No. No diagnosis.
Anybody? It is a bonus question. The people who didn't ضيع البونس
لا.
على الناس.
لا أعرف إنه يعني إنه هو كيف الصيغة من علاج أو
Take your song.
هو كان يستخدم العلاج المورفين بعدين زاد الدوز.
increase in tolerance?
It is tolerance, حتى not increase or decrease. When you say tolerant, that means, well, people, they tolerate it more, they have to increase the dose, and they have, in order to have the same effect. This is the tolerance architecture.
May I please go to the bathroom?
Say it again.
May I please go to the bathroom?
Oh, yeah, please go. Sorry. You should take Saif al-Islam with you. What is that? What is that? What is that? The completing the diagnosis. Okay, how to treat this patient?
We give him
You say benzodiazepine.
for the withdrawal symptoms.
Wrong. Would you treat opioid by benzodiazepine? Opioid disorder? Okay. Again, another issue, but this is why I'm trying to make, to make it be so obvious for all of you, because it's very important.
ميثادين
Methadone.
ميثادون بس موجود عندنا في الشقة الميثادون.
مثلنا ميثادين بطل بس اسمها ميثادون عندنا ولا لا؟
أنا أقصد بنزودايزابين.
I hate this benzodiazepine. No, the answer is no. Why? Okay, why?
It's sedative.
Why? You are treating what?
Substance use.
Okay, you are treating what in this substance abuse?
Addiction.
Do you think that addiction can be treated by another addiction drug? I'm treating, I will give, okay, this is the issue. Okay, methadone. ما عندك methadone. What you will do?
دايزابين. لونج
ما هو نفس البنزودايزابين. خلاص خلصنا from the family history or family benzodiazepine family. Diazepam or whatever benzo, it is benzodiazepine, families. What else? You said methadone. What else? ما عندك methadone. طبعا wrong to use this. I never used benzodiazepine in treating opioid. What else? What else?
Naloxone. Naloxone.
And naloxone.
Naloxone, yes.
Thank you very much. But when? This is why he will be in trouble. Thank you very much. You need to specify. Listen to me, all of you are saying. It's very important. When you say that this patient is opioid or substance abuse, you should, you must put this patient in withdrawal or in intoxication. In which phase? Naloxone, I will not give him naloxone, for example, if he has withdrawal, right? I'll give him naloxone, pinpoint, if he is really intoxicated with this, he come to you and he is almost drowsy and because of overdose of heroin, regardless of, is it for pain or for what use, whatever, but you need to mention, to make sure, am I dealing with withdrawal symptoms or with intoxication? It's the same issue with alcohol. I'm treating alcohol intoxication or alcohol withdrawal. Any caffeine intoxication or caffeine withdrawal. This is very important. Any substance. هذا الرجال جاي وشارب الدنيا كلها الآن. Or دخل المستشفى وعملنا له surgery وما عاد عنده alcohol. So he doesn't have alcohol or he is over drinking. This is very, don't forget it, please. Either intoxication, إما أخذ كثير, or he doesn't have it. Then I can treat. If he is, for example, alcoholics, and he has withdrawal, what do you expect?
Shaken hand.
What is the diagnosis?
His diagnosis is fatigue. In this case, or
And alcohol withdrawal. We mentioned that before.
Delirium?
Delirium tremens.
delirium, doctor, after
we said withdrawal.
So بشكل عام.
Withdrawal إذا كان في shivering and withdrawal with the symptoms of withdrawal نحن ما تكلمنا على how many hours. Talking what is the name of this? Okay, it is called withdrawal tremors. So if he is using big amount of alcohol ودخل عندك as a surgeon and you saw him shivering and he started to have illusion or whatever delirium, well, I'm dealing with alcohol. Please give him a bonus, okay? You need to understand if this is intoxication or not. This is very important, and this should be during the interview. Before going even to the mental state, the picture should be so clear. When you need to ask him, when was the last time you utilized alcohol or utilized opioid or whatever? So you need to ask the last time he took it. Okay? Very vital things. Timing is very important. And of course, if it is intoxication, you would expect his alcohol intoxicated, will feel drowsy and his gait and light, and at the same time it will be smelly. Thank you very much. Okay, and at that time you can talk about benzodiazepine. If he has withdrawal, delirium tremens, it is a must. You need to give him benzodiazepine. Okay? Agree? How to treat this patient? طبعا the drug that you missed هو risperidone, antipsychotics. You can treat this patient with antipsychotics if you don't have methadone or any antidote issues. Okay, how to treat this patient? You said socially and psychologically. CBT. We call all of these things actually rehabilitation issue. So you need, this patient need rehabilitation, and the key issue من والله ما علي صاحب لا حسين ولا حسن ولا هوبر. Okay, let him change his beers. ناس حشاشين ما يتعالج معهم. Okay, ما ينزل. This is the key issue, just to change the environment. Okay. Okay then, thank you. When you see him, ما حتشوفه خلاص. Usually 1 week, please. That unless the percentage disorders, because you didn't give him any medication to see him after 1 week, unless you are really started the real psychotherapy yourself. Okay.
So 1 week في كحول حتى نفس النظام البرد.
Yes, of course. كلها عشان you need to make sure that this patient is compliant with your medication. Okay. في قضية مهمة the diagnosis, and this is the question for all of you. What is, how can I put it? في قضيتين مهمين, bonus questions. First of all, this patient, you said he had opioid abuse, and you mentioned that depressive symptomatology, right? Feeling depressed, and what is the things we say it in our diagnosis? This is a term well known in drug abuse and substance abuse. Okay, I put it wrongly. Have you heard about the dual diagnosis? Dual diagnosis. For the drugs, you have 2 diagnoses at the same time. You said that this is drug abuse, alcoholism, whatever, okay, and depression, or whatever things, okay? So you have 2 diagnoses at the same time. Thank you.
So depression بس ما جت بمخي يجيك diagnosis.
هنا